Lindsay, first of all, I guess the question is, what exactly will the department be spending the money on? And maybe even more importantly, is it enough?
Good afternoon, Jeremy. Well, that's the point that the Health Ministry was making to Parliament this morning, that they had initially asked for some 37 billion rand for their response to the COVID-19 pandemic, saying, of course, that was based on modelling at the time. So right now they're having to deal with 21.5 billion. Most of that, they say, will go to the provinces. But, Jeremy, really big items on the expenditure list there for a COVID-19 field hospital in KwaZulu-Natal, and also to pay those Cuban doctors. But most of the money, as I say, will go to the provinces, yet to be determined, however, exactly how much each of the provinces will get.
Lindsay, inevitably we've got to raise the spectre of corruption and the inability possibly of provinces not to spend the money that is allocated. It begs the question about checks and balances.
It does indeed, Jeremy, and that's the point that the Chief Financial Officer of the Health Department was making to Parliament today, that this money will have to be accompanied by business plans. They are waiting for provinces to submit these plans as to exactly how much they will be spending and on what. And we know that one of the important things provinces are supposed to negotiate in terms of fighting this pandemic is a rate for overflow patients from state facilities to be able to be treated in private facilities. Here in the Western Cape, that agreement already advanced. Gauteng, we heard this morning, following suit, and of course in the Eastern Cape as well. So also the point made by the department that they have the Auditor General representatives working in the National Department, keeping a close watch on exactly how all this additional money is being spent.
Just finally, having said that, the department itself is not going to escape the Tito Mboweni guillotine. It will also have to make its own sacrifices.
Yes, it will indeed have to make its own sacrifices, and it's really this point that really have MPs concerned today when they heard that some 604 million rand for programs involving HIV, AIDS, tuberculosis, malaria, that's where the budget cuts are going to come. But the Health Department says it's not as if the money will be taken away from these particular allocations and moved, but this is really where they will look to, should they need the extra money to shore up their response. That's where the money will come from. And of course, MPs very concerned that they don't want to see budget cuts to HIV/AIDS programs, but they're saying that there could be extra money because of the slow uptake of people taking up ARVs. So that's really where a large chunk of money will come from. But the Health Department giving them the assurance that they will not be cutting any money from their plans to get the National Health Insurance Fund off the ground, and all related infrastructure that goes with that program.
All right, we'll await that announcement a little later on. Lindsay Dentlinger, thank you.